what made you or choose this specialty? How did you land the job? Was it just something that like popped in your lap, or what happened there? How much does a pain management PA make in South Florida? What does a typical day look like for you as a pain management PA? How many patients are you seeing a day? Are you going to multiple hospitals? Are you working outpatients? Everything that you know. Do you think you would choose being a pain management again? Hi, everybody. Welcome back to another episode of DaniThePA Podcast, where I am on a mission to find the coolest PAs and their jobs, talk about medicine and life beyond the highlight reel that you see on social media. I'm Dani, your podcast host, and this is Joanne. She's one of my PA school besties. So excited to have you on the show today. I appreciate you for coming out.
Thank you for having me.
You're
I'm excited
welcome.
to be here.
Of course. So we're going to find out about her role as a pain management PA. I feel like this is like a super niche and very needed specialty that is consulted by the ED and every hospitalist PA out there. So tell us about yourself, who you are, how many years of practice you have in this specialty, and what city/state you practice in.
Okay, my name is Joanne. I work in pain management. I work primarily in like the Coconut Creek kind of Coral Springs area.
Which is in South Florida.
Yeah, South Florida, sorry. And I've been at this practice since I finished PA school, actually. So about 4 years.
You graduated in 2021.
2021, yep.
Awesome.
And then we started right after that, probably in January of 2022.
Now, I feel like this is like, I don't hear a lot of people working in pain management. I feel like that's kind of like a taboo.
Yeah, it's
type.
very niche.
Yes. What made you or choose this specialty? How did you land the job? Was it just something that like popped in your lap, or what happened there?
It honestly popped into my lap. I started looking for jobs, and then it kind of just landed in my lap, and I was like, hey, it's a good opportunity. Mm-hmm. And I got into the job and I liked it. And so I kept it.
Yeah, you've been there long. That's pretty impressive.
Yeah.
So why specifically this specialty? Was it just like decent pay and benefits and location, or was it the doctor or coworkers that were interviewed? Like, what made you, I guess, choose this specialty?
Honestly, it was more so like I just wanted to get my foot in the door at one job at least.
After graduating.
After graduating. And so that was what landed on my lap. I took it. The doctor seemed nice. And so I was like, hey, I'll just go for it and see how I do. And it worked out.
Yeah, awesome. Good for you.
Yeah.
So what does a typical day look like for you as a pain management PA? How many patients are you seeing a day? Are you going to multiple hospitals? Are you working outpatients? What does it look like?
So I work primarily in the inpatient setting. So I go to about 2 hospitals a day, sometimes 3.
Oh, wow.
But I kind of start around like 7 a.m., I would say. And then I leave once I see all my patients. So that's usually around like 1 p.m. Mm-hmm. And then I go to my next hospital. I repeat the same thing, and then I go home.
Yeah. And so how many shifts are you working typically a month?
It's not really shifts. It's more so I work basically essentially every day, which is kind of crazy. But
really?
Yeah, essentially every day. I get about 4 days off in a month, basically. So 2 weekends off.
Okay.
Every month.
But you're not working long days.
No.
How long are you typically?
They're usually about like 4 or 5 hours.
So you go in, pop in for a bit, see all your consults, and leave.
Yeah. So go in, do your pre-rounding, do your notes, all that stuff, then you leave.
Okay, that's not terrible.
It's not bad.
So do you feel like you are seeing over 20 patients a day typically on your rounds?
It depends on our census. Obviously, some hospitals are a little more higher, some are lower. So I would say about 30 between both hospitals.
Wow.
But sometimes it can go up to like 40, 50 between kind of.
And you can bang that out in a couple hours like that?
Yeah. We're not seeing every single patient every day. Obviously, there's some that like are kind of like, you see them for once.
You put in your PRN orders.
Yeah.
And then they're kind of set.
They're kind of not taking anything. So then you're kind of like, okay, well, then we'll kind of skip them for the next day. Okay. But if we need to, we'll go back and see them.
All right, that's pretty cool. So in your role, do you feel like you're pretty independent in your role, or you feel like you have to have a lot of supervision? Because you're dealing with narcotics and stuff like that. So how does that work?
I'm pretty independent in my role. I would say that I sometimes work with my doctor. Some days we're working together. So sometimes we're rounding together. So usually like we kind of round together, then we go to see the patients, and then we put in orders together. But most of the time, I'm rounding by myself.
And you feel
doing everything
pretty
myself.
confident on your own. You don't consult often the doctor.
It depends. So sometimes some patients, there's always like some questions that you're kind of like, hey, I don't really know what I'm doing. Like, do you think I should do this? Or because obviously they're narcotics. So like the higher you go, you're kind of like, oh, this is kind of like a little scary territory. Yeah. So it depends. But in the beginning, I was consulting him a lot. I was like calling him every day, like, oh my God.
Yeah,
like,
of course.
Do I put this patient on this or that? But like now I feel like I ask like very like specific questions and very specific cases that I ask. But for the most part, I'm doing things on my own.
And in your practice or in your group, how many of the APPs are there versus attendings?
So we just hired a new doctor. So we are about 3 attendings.
Okay.
But it depends because some of them rotate different hospitals.
Yeah.
And then I'm really the only full-time PA that they have. Then they have 2 NPs that are kind of part-time.
Okay, cool.
Yeah.
Is there a work from home opportunity?
There is. So 1 weekend from home, I work from home.
Okay, that's not bad.
It's not bad.
Are you on call at all?
Technically, yes, but
Right.
you're not really answering the calls. It's actually the doctors that are answering the calls. So you're really just kind of doing the notes, and then some nurses will call you, some doctors will call you, but for the most part, they're kind of deferring all to the doctor.
Yeah.
It's not too bad.
And do you feel like you're just prescribing medications and not doing any procedures, right? You don't have a lot of procedures in your role, or you do?
You do when you do it on an outpatient basis, but I only do inpatient. So if you're on an outpatient basis, then yes, you do like epidural steroid injections, you do like trigger point injections, things like that.
Does your clinic or your group have an outpatient office where that's
they do.
performed?
Yeah.
And the physicians are usually doing that?
Yeah.
Okay. All right. Cool. So you're doing all the inpatient stuff. What meds are you pushing all day long? Is it like Dilaudid and morphine?
Everything.
Yeah.
Dilaudid, morphine, Percocet, hydrocodone, tramadol. You got them all.
Yeah. At first, was that like kind of sketchy to you?
Yeah. It was scary because like it's narcotics. You don't want to get in trouble. The DEA.
Yes.
You're like, oh my gosh, I prescribed this person like Percocet. Oh my God, am I going to go to jail because I gave him like Percocet? But you get used to it.
Since you're inpatient, you're not sending people like home with like extended scripts?
But like 3 days
Oh,
is
only
like
3 days.
the maximum, yeah.
Yeah.
On
And
special cases, it goes up.
what about the
like,
sickle cell patients and stuff? Is that like their hematologists dealing with the
No, sometimes
chronic
you
pain?
will.
Okay.
It depends. Some of them have like chronic pain outpatient like follow-ups, but then some of them don't. Some of them have like more so like hematology follow-ups, and they kind of have crises where they're kind of coming in once or twice or 3 times like a year, and then they're like getting pain medication prescriptions going home.
Yeah. And then, so you said you work every day. We just kind of brushed over that.
Yeah.
I can't believe that because you've been there for almost 5 years, so you must be happy. How are you happy working nearly every day?
Honestly, it's because I don't work like 12-hour shifts. I only work like 3, 4, 5-hour shifts. So like on my busiest days, I'm there for like 5-6 hours. But if I'm not, it's usually like 1-2 hours.
Yeah, like she worked
like-
this morning, guys.
I did. I worked this morning.
That's
And I
crazy.
came straight here.
That's funny.
Yeah.
Okay, that's cool. So you're obviously working weekends, you're working holidays.
Yeah.
You have not really on call, but you do work from home. What are you doing from home? Just charting or anything else?
You're charting, so you're kind of starting the notes for the doctors, kind of sending like the patient information to them, kind of like a little synopsis, like sign out basically of the patient to them. And then you sometimes will do notes, sometimes you don't. It just depends.
And so just want to clarify, you're only managing people's pain. You're not ordering labs, interpreting tests or imaging. You are? Yeah.
So sometimes patients will come in with like low back pain, going down like radiculopathy, and like you have to order MRIs. Or
Okay, so you are.
Sometimes patients are coming in with like back pain, and you're ordering like LSO braces if they have like a fracture or anything.
I would like expect like the ER or the hospitalist to have already done that before they consulted you.
Do. Sometimes they do, sometimes they don't. It really just
So you got to
depends.
cross your T's and dot your I's before just writing away their pain with a narcotic.
Yeah. I mean, we do a lot of like procedures like the kyphoplasty where you like put the cement in the back. Like we do some procedures like that in the office. So like we kind of know what to kind of order, how it goes. So we kind of put in those orders.
Okay. All right. That's pretty cool.
I feel like everyone works as a team in the hospital. So like 100%. Obviously like sometimes some people miss things. Obviously I miss things too. So like sometimes
we're human.
sometimes you got to put in orders for other people. That's okay.
And do you feel like working in your current job is like sustainable long term? Like I always ask this question, like for a woman who's trying to raise a family, for example, because that's like what I'm doing right now. I have a 1-year-old. Do you think I would survive kind of working a few hours every day, or you feel like it's not sustainable?
Honestly, it depends on what you're looking for, what you like value, I guess.
Yeah.
If you're okay with like going back home around like 1 p.m. and like having the whole day with your kid, that's great.
Yeah.
But you are working weekends, you are working holidays. So it's kind of pros and cons.
Yeah.
Personally, for me, I don't have a kid.
Yeah.
I am not married, so I have no obligations. So like I'm just kind of
She's a free
riding the
bird.
ride,
Yeah.
like riding the wave all the way through. So
Yeah, that's not bad then.
yeah.
And do you feel like you're well compensated for how much you're working? Like I kind of want to get into this next
I think
question.
so. Yeah.
If
I
you're
think so.
comfortable,
Yeah.
ballpark or specifics, like roughly how much does a pain management PA make in South Florida?
So I think base starting salary versus like now is obviously different because I'm 4 years in. So
Yeah.
experience changes things.
So she's
but-
getting raises, y'all. That's not very typical.
I am.
Go ahead.
So when I started, I was probably around 95 to 100 around there. And then now I'm between 120, 130. But our office also does bonus structure. So we get a bonus at the end of the year. We also get bonuses after you see more than 40 patients, I think.
A day. Mm-hmm. Yeah, because that's a hefty day.
Yeah.
Okay, cool. And so you're salaried? Or
I'm salary. Yeah.
Okay. So in your, I guess, negotiation in your contract, like they expected you to kind of work every day?
Essentially, yeah.
Okay. All right. So you knew what you were getting
Yeah.
into.
Yeah,
Okay.
they told me from the beginning, like,
All right.
hey, this is what your schedule is like. You either take it or you don't, right?
Yeah.
Kind of thing.
Okay. Are they looking for more,
Yes.
APPs?
Yeah.
Oh, okay.
They're always looking.
All right, cool, guys.
The more, the better.
So you already answered my question, does pay grow? Is it like a set percentage each year, like 3% or something? Or
Not necessarily. I think it kind of depends on how you feel in the moment and also like if you feel like you want a raise or not kind of thing. But they're very like malleable in the sense that like if you tell them, hey, like I feel like I deserve a raise at this much or this is how much work I'm doing and this is how much I think I deserve, and they'll kind of raise it up.
and you work with a private practice, right?
Private practice, yeah.
Okay, cool. So your salary, do you have decent benefits? Because I have very shit benefits. Do you have okay benefits? What does yours look like?
Mine is like I get 401k. I get PTO. I don't get health insurance, unfortunately.
Wow, yeah.
Yeah. So I'm paying
Healthcare
that
providers
out of
not
pocket.
getting health insurance.
Yeah, I'm paying out of pocket for that. They do pay my malpractice insurance.
Okay, good.
And they do give me CMEs. So
All right, so I'm curious, what would you say the best part of being a pain management PA is?
So I would say it's kind of like highs and lows. Obviously, you're in a inpatient setting. I think we try to manage a lot of different types of pain, right? So chronic cancer patients,
Ooh, yeah.
acute patients, you're seeing post-surgical patients, you're seeing everybody. And I feel like we do good because they're in less pain the next day. So I
Yeah.
feel like we're doing something that's like helping somebody
Yeah.
at the end of the day.
Pain is serious. It's taboo, because
It
some
is.
people abuse the
Very
system.
taboo.
But your specialty is very much needed because everyone is scared to walk that line.
Yeah.
So what would you say like the worst part of being a pain management PA is?
I think the worst part is kind of obviously you see these cancer patients too. So sometimes you can't manage everybody's pain,
Yeah.
unfortunately.
It's intractable.
Yeah, pain is also subjective. So it's hard to kind of, sometimes you give them anything you can and sometimes they're just not
Nothing's
any
working.
better.
Yeah.
And it sucks, but
Yeah, that's life, unfortunately. So knowing everything that you know, do you think you would choose being a pain management again?
I think I would right now because I'm comfortable where I'm at.
Yeah.
I'm comfortable with my physicians. I'm comfortable with my coworkers.
Yeah.
But would I choose it again if I had a child and if I was married? Maybe not.
Yeah.
But I do love my job.
That's
I
good.
do.
Awesome.
I'm happy where I'm at.
All right, that's awesome. We heard like a very niche specialty today. Thank you, Joanne, for coming in the podcast. I appreciate it. Been a long time.
I know.
So that wraps up today's episode of Danny the PA podcast. These are the types of conversations that I was hoping to have when I was looking for a job in the PA career. So I hope the listeners solidified some of your decisions or reassured that you're, making the right choice in choosing your specialty. But if you want to hear from a certain specialty, please feel free to comment that below. Or if you are a PA and you think you have a cool job and want to be on the podcast, please email me. It's DaniThePA@gmail.com. That's 2 I's, DANII, thepA@gmail.com. Also follow me on socials, Instagram, TikTok, YouTube @DaniThePA. Show some love. Appreciate it, guys. Thanks for listening.